to
Yes.
continue with your current? Okay, cool. Good evening and welcome. The North Carolina Business Committee for Education and the North Carolina Virtual Public School are proud to host the North Carolina Career Connections Speaker Series. The speaker series includes presentations about career paths and jobs by those working in the field. We feel that it is never too early to start thinking about your future, and we are now providing a platform for our students to gain insight and exposure to potential career paths while still in middle or high school. And tonight we're really excited to have Michael Hayes with us. Mr. Hayes is a graduate of the Winston-Salem Forsyth County School System. He attended Wake Forest University, where he received a Bachelor of Arts degree in psychology, and then attended Wake Forest for graduate school as well, receiving his Master of Arts in Education and Counseling. He is a national certified counselor and a North Carolina licensed clinical mental health counselor as well. So thank you so much for being with us this evening.
Glad to be here. Thank you.
Yes. And so I just thought I would ask a little bit about what led you into this field in terms of your interest.
To be honest, probably not having such a good experience when I was in school as well. I could have used a counselor. I wish my parents had both had the opportunity to do that, as well as had seen the possibility that would have been helpful. I think when I majored in psychology at Wake Forest, that opened up a lot of ideas about how people think and how people make connections. So it seemed to be a natural move into counseling as a career, and I kind of got into it from that way. Actually got into as a school counselor for a while in the school system for about 4 years, and that was how I started out, and then have moved into private practice from there.
And when you were a school counselor, were you high school, middle school, elementary?
I was a middle school counselor for 2 years, and then I was a high school counselor for 4 years at East Forsyth. And then that was the time, about 1984, that they started recognizing counseling through both a national certification program as well as state licensure. And so one other counselor from West Forsyth and I got together and got licensed and certified at the same time, and resigned from the school system and opened up a private practice in 1985. I've been doing that ever since.
Wow. So is that the population you still work with, mostly middle and high school?
Mostly 10 years of age is about the youngest, and it's extended beyond high school. I have a lot of what I call 30-year-old adolescents that just haven't quite flown the coop and grown, and so I end up working with a lot of young people that are in and out of college or changing careers for one reason or the other, and have gotten back into counseling with me.
Okay. And so are these clients you had previously or
A
both?
little of both. A little of
Okay.
both. It's interesting in a city the size of Winston-Salem. You tend to make connections both through pediatricians, as well as school counselors, as well as church area organizations. And if I didn't have a Yellow Page ad, I wouldn't get one, because word of mouth is generally the best referral source.
Sure, absolutely. And so we talked a little bit before we formally began about how COVID has affected counseling.
Yes. It has affected a couple of different ways. I think, in fact, I just had this conversation with another therapist last week. We're seeing right now, I think, a lot more of what I would describe as PTSD, based on being out of school and out of touch and out of the socialization process, and that I'm experiencing lots of middle school and high school and even some college students that really haven't been involved and connected in their school in a more personal way than 2D like we're doing now. And it's been a lot more difficult for them to return to real-time school or real-time church or real-time socialization. So I think it's affected people in that particular way. It certainly has changed how we as families adjust. People working from home, excuse me, working from home, and having to do school at home. I've got, families with 4 children. They've got a kid in every room of the house, and mom's in the bedroom working and dad's in the garage working. And so I think it's made a real impact on how we work together as families. Some very positive things, but I think a lot of negatives.
Mm. Yeah, and so you're talking about the transition has been hard and sort of this PTSD type of mentality of being out of touch. And so what are some things that you talk to your clients about to help with this time period and then the transition back?
Well, I think it's kind of threefold. The first is identifying, is it really an anxiety disorder that you're experiencing? Is it more of depression? How are those two joined together? And how do you address the anxiety and depression? The second thing is just practicing communication. When we get very used to, texting or talking to people this way, but how do we practice that with family members? How do we practice that one-on-one? And kind of urging people to find ways to practice that. And then I think the third thing is to realize we're all in the same boat.
Mm.
We're all dealing with it the same way. That I know you guys as teachers have experienced a real disconnect with being able to teach kids in person, and I think it's been very difficult for you guys, and then it has been for parents. So this is not like I stand out and nobody else understands. We all understand, and I think that
Mhm.
makes it a little bit easier for somebody to say, okay, I can take a chance because other people are experiencing some of the same things I am.
Right, definitely. Um, and we've been talking about in psych class, and I really believe that this younger generation is much better than my generation about recognizing mental health issues and talking about mental health issues. What have you seen over your career in terms of the acceptance and the knowledge surrounding mental health?
I would agree. I think we have the wisdom of the ages at our fingertips anyway, and can research that. I think unfortunately sometimes we research the wrong things, and that can be problematic. But I think the reality is that we're a lot more aware, and as long as we don't self-diagnose and say, oh, I think I have obsessive compulsive disorder. Maybe you have some symptoms, but I don't know that you have the disorder. But I think the awareness is there. I think there's also a lot more acceptance of actually receiving the help and the assistance than there used to be.
Hmm.
I think what I'm seeing a lot with young people from college to high school is that they're more willing to reach out and more willing to make connections. And in some respects, having telehealth as a possibility has made it a little easier. But I think that it's not quite as personal as it is in person.
Yes, agreed. And kind of going back to your profession, and so you received a degree in psychology and then a master's degree in counseling. Is that the route that every student needs to take if they're interested in a career in counseling?
There's
Or-
multiple ways that you can get to this particular place. You're certainly a 4-year degree. It could be in psychology, it could be in sociology, it might be in education, it could be in criminology. So the undergrad is not as important as the graduate school and the experience going into that. For most of the graduate school programs, the master's level is the beginning of where you would be able to do any type of therapy with someone, but it could be a master's in social work, it could be a master's in psychology, it could be a master's in counseling. And then a lot of people are not aware that even though you have the degree, that you can still begin to do some of the therapy. You have to also be an associate for a while, which means somebody has to supervise that for a couple of years. And so, 4 years of college, 2 years of a graduate program, and 2 years of supervision, you're looking at before you can be very independent. You're probably looking at 8 years total. You could get a doctorate in psychology, or a doctorate in educational psychology, and do the same thing, which would be additional education. 10 or 15 years ago, that would have made a bigger difference in the amount of income that one might make as far as insurance reimbursement. Less of an issue now. We're seeing more and more joining of different fields to actually be under the same umbrella. So, but the master's is probably the least direction that you need to be looking at in order to do this.
Okay, and then there's an exam that you have to take to in order to be licensed?
Most states have a licensing exam of some kind or the other. It's usually state by state. One of the things we're seeing, because people move and travel a lot, it used to be that if you were licensed in one state, that you may not have reciprocity in another state. But now we're seeing that gap close a little bit, so that if you decide that I'm going to move to Colorado, that Colorado would recognize your licensure in North Carolina, and vice versa. So we're seeing that become a little bit more amenable to people moving than it used to be. But yes, there's a licensure exam, and that's the end stage of your master's, is getting your license, and then there's the supervision piece.
Okay. And what about you? You mostly focus on, you said 10 and up. Is there anything that a person needs to do so that they can say, hey, I only want to work with families, or I want to work with young children?
Yes, there's, in the master's level programs, for example, you can be in the same master's level program, but maybe declare a different direction in your area of study. There is the American Association of Marriage and Family Therapy, so you can be AMFT certified and actually do marriage and family counseling only. There are lots of certifications that are additional certifications to having your degree. You might be an addictions counselor. You might be a counselor who is specializing in eating disorders. You might be a counselor who specializes in anxiety-related disorders only. And that can be very helpful if you're the expert in that field, but it can be very limiting if you live in a small enough community like Winston-Salem, where you may have to have some flexibility in dealing with certain areas.
Sure, that makes sense. And we have been talking a little bit in psych class too about maybe the prescription of medication not just being what a psychiatrist would do or another physician. So what's kind of happening in terms of conversation around that?
There's some movement in that to look at further certification for master's level and doctoral level psychologists to be able to look at medication management. The medication management right now, psychiatrists, yes, they do a lot of that in more difficult cases, but we've seen in the last 10 years or so, pediatricians are very willing to do medication management. Physician's assistants and nurse practitioners are also able to do medication management. I've often discovered that I know, because of the experience I've had, I know more about some of the medications than some of the doctors do, from seeing so many different people and the interaction and the reactions that they have. So there is some move afoot to be able to certify people that are master's level do medication management. Honestly, I don't want to do the medication management because it's such a broad spectrum, but I think there are people that could do a good job with that. Either way, you need to know a lot about it so that you can understand how to work with somebody that may be having an adverse reaction to a particular medication.
Sure. And so we've also talked in class about, the talk therapy, the drug therapy, and the combination of the two. So maybe you could help the students sort of understand how they each play a role and in what ways.
Yeah, and I think it's important to kind of validate the talk therapy, and the talk therapy has several areas. It might be cognitive behavioral. What I think affects how I behave. If we can change how I think, the behavior will change. And then there's dialectical behavioral therapy, where I can learn some certain skills to respond and react to certain behaviors that tend to push my buttons. So it's more than just talk as well. It's really, here are some solution focused ideas. Here's some directions of getting the support that you need to help manage either the anxiety or the depression that you're dealing with. I do see people that will go straight to their doctor and get on a medication, and they tend to feel better, that they haven't made any changes.
Mm.
And so if they stop the medication, then they're still back to square one. I have seen people really fight really hard to work through the anxiety and depression they're dealing with without medication. And they tend to learn some very good skills to deal with that. But if their reactions are physiological, we can't make the physiological better. And so we do have some people that are more seriously biologically or physiologically affected in their depression, and that's when medication is most helpful.
Yeah, that makes sense. And so we've also talked a lot about the different perspectives this year in psychology and looking at, like you said, the cognitive behavioral therapy, looking at the cognitive, the behavioral approach, humanistic approach. And it seems like that cognitive behavioral therapy is sort of the main mode of therapy. And we sort of talked about those neo-Freudians seem to be a very small group at this point. So
Yes.
wondered if you just sort of speak to us about the different perspectives and
Yeah, and I think a lot of it depends on how you've been trained. If you're in a master's program in social work, they're very solution focused. Excuse me. They're very much, what's the plan of action in the shortest period of time to get somebody at a different place. There's a lot of good research on dialectical behavioral therapy of giving people specific toolboxes to work with, but they may not have a lot of individual understanding, but they can manage the things that they're dealing with in their life better. I think that the majority of people probably use a very eclectic approach, and they borrow what has worked for them with other people. I do use a lot of humanistic approaches, at least meeting somebody. The cognitive behavioral comes very handy with somebody who's dealing with family issues and in that communication. I'm not trained to do DBT, the dialectical behavioral therapy, but I see that people that are in a DBT group can often bring back into counseling some of the skills they've learned there. Solution focused therapy is often very good in family therapy. What is the solution, the middle ground that we can find? How do we get there from both ends? So I think it's a matter of having a toolbox and using the tools that work with a particular client, and what you can match up what is their approach to feeling better and doing better, then you can capitalize using the approach that helps them the best.
that makes sense. And you kind of touched a little bit on my next question. So the students often ask, what are the benefits or the differences between individual therapy and group therapy?
And that's a good question, actually. Individual therapy is very personal, very with the right therapist. It has to be a good match. It's very personal. It's very intimate in the emotions that you're sharing. Group therapy is a little less intimate and less personal, but it can be kind of like the group benefit of people behind you having a family there. But every group is different, and the makeup of every group is different. And putting together a group it's very important as you consider the health and welfare of each person in the group. Groups need to be limited in number. You usually need to have two people doing a group, so you have one person processing and one person in support. So it takes a lot more coordination to have a group. So I think there are some benefits in groups. They tend to be used a lot more in hospitalized settings or in therapeutic program settings, because you can maximize the support of the people in a group as well as do individual therapy. I have done groups in the past. They can be very helpful and very moving and very powerful. They can also explode.
Mm, that makes sense. Yeah. So, and you don't necessarily know when you start out what kind of mix you have in
Right.
that group, whether it's going to
Exactly.
be volatile or not. And so we also, you mentioned people who would be hospitalized with a mental health issue, and we've talked a little bit in class too about the deinstitutionalization movement,
Yes.
and wondered if you would talk a little bit about, we looked at the Rosenhan experiment and
It's been interesting to watch that over the last 30 years or so, and it's been primarily insurance driven. How effective is having someone hospitalized for more than 72 hours? versus the pay that the insurance company would be paying to have that care for them. And I think we haven't found the right balance yet. If I have someone who is really dangerous to themselves or other people, and they need to be hospitalized, whether it's involuntary or not, unless it's a very serious situation, they're probably going to keep them 72 hours is the average, 3 days.
Mm. Okay.
That's not really enough time to change a medication and see the effect of the change. It's not really enough time to manage, personal changes that they're trying to make, but it keeps them safe. So, literally, hospitalization right now is about safety.
Hmm.
But then, if I can get them back in once they've been hospitalized within a few days, that's great. But if I have a full schedule, that's very difficult. And so I think the in between is, what is the intensive outpatient program look like? And we haven't really done a good job managing intensive outpatient programs, that we go from an intense hospitalization to an intensive outpatient program for a couple of weeks back to individual therapy. So I think we're missing that important link, and that's not been handled very well, in my opinion.
Hmm. That makes sense, that middle
In fact,
ground.
there's not an intensive adolescent outpatient program in Forsyth County unless you're in one of the therapeutic programs right now.
Wow.
Yeah,
I didn't,
sad.
it is. I did not realize that. And so, shifting gears just a little bit, we talked about your formal training and learning. What are some of the surprises that after you went through, maybe in that time where you were doing sort of that associate work, that your formal training did not prepare you for?
The best way I can describe that is, somebody teaching you how to swim by throwing you into the water with a life jacket on, and you get to keep the life jacket for a while, and then you take the life jacket off, and it's like, oh, I've got to learn how to swim. You didn't tell me which direction, and you didn't teach me how. You just said you need to figure this out. And I think, probably 1/10 of what I know was learned in graduate school, and the other 90% I've learned on the job training. I certainly am required to continue to do continuing education credits and learn, which is important because there's lots of new information out there. And I think that's the intention of the 2 year or so. It's actually 3,000 hours of supervision, so it's about 2 years, is to give you some time to get your feet wet and do that. But even with that, I think I've heard it all, and then there's a new situation that comes in. It's like, haven't had that situation before. I need to do some research.
So, what do you kind of do when you're meeting with a client and it's, I mean, I'm sure it doesn't happen to you at this point in your career, but in those early days and you think, "Oh, I'm not really sure where to go in this direction," and you're
Well,
sitting in front of the client.
yeah, I think it kind of is an unfolding process. I have about half and half of my clients that come in here to come in because mom and dad made the appointment,
Mm,
and they're
mhm,
really okay. And the other half saying, I've been trying to get counseling or therapy for a while, and mom and dad finally said okay.
mm.
So I know I have 30 seconds when I walk into the room here in the waiting room to meet somebody, to make a connection. And so, one of the things that I do first is I always know the person's name that I'm going to see when I'm walking out there. I always make eye contact and speak to them first before I'll walk past a parent's outstretched hand to make a connection with the client that I'm going to be working with. I know it takes about 3 sessions once that happens for me to kind of get an idea about where we're moving in the direction with this. I am bound by the ethics of my particular profession, that if I am practicing outside the scope of my base of knowledge, then it's my requirement to refer them to appropriate resources, whether it's an eating disorder resource or whether it's hospitalization because of the fear of the danger of them hurting themselves. And so I have to make that assessment usually within the first 3 sessions that I see somebody.
Yeah, and so you kind of already touched on a little bit of my next question, the soft skills. So you talked about the making the connection, the eye contact, using the person's name.
Mm.
Are there other things that students who want to enter this field should be aware of?
Yeah, I think that the number one thing is empathy. You cannot teach empathy to someone. And I think that, if there's a connection that you recognize that you have, that I can feel, the pain that someone else is feeling. I can understand how somebody else may be acting based on what's happened in their life, and you recognize that your empathy is pretty strong. I think that's the number one thing. We can teach anybody a skill. We can teach them, a cognitive behavioral pattern. We can teach them, dialectical behavioral skill sets, but we can't teach empathy. And I think that's the biggest thing, that it doesn't matter whether you have doctor in front of your name, or whether you have a master's degree or not, or whether you've been practicing 40 years like I have or not. If you don't have empathy and you're not going to make a connection, you're not going to be very effective.
That makes sense. So, if a student has interest in the field of psychology, but maybe isn't so sure they want to work in a therapy setting, what are some other avenues for them?
Oh, there's lots. People can work in hospital settings for sure, and that doesn't necessarily mean mental health hospital. It may be in a hospital setting where it might be a specific area of, for example, grief, and so you might be working in a cancer center. You might be working in a clinic area, so you're not one-on-one and doing therapy, but you're working with other people and working in teams. Uh, there are some doctor's offices that actually have counselors there, and so they're fielding parenting or other issues that are pretty short-term kinds of issues. Certainly schools and school settings, there's lots of areas where counseling can be involved. I think there's even, for example, somebody is obese and is trying to have the bypass surgery for gastric bypass. They involve counselors specifically to look at those areas, that work in that hospital setting for that. So there's a variety of areas that people could work in that would not necessarily be doing therapy.
Hmm. That's interesting. And what advice would you give to students or even adults with a career change? You mentioned you're working with some of those as clients who want to go into this particular field.
Well, three things I would say. Number one, we don't have enough counselors or therapists to meet the needs that are currently going on. And I think I'm kind of gray. We're seeing a graying of the people that are also in it right now. So, I'd like to retire in about 4 years. So I need a bunch of young people to come in and take over and do what I've been doing, because I think the need is greater than it's ever been before. So I think, if people are questioning, oh, is it a flooded field? Not at all. Is it a field that's ever evolving? It certainly is. I think the insurance industry is helping us evolve a little bit. And I would love to see more people move away from insurance as being the way of getting paid, because I think that they're trying to control more and more of what happens in the outcome with that. So I think the need is there. I think the job possibilities are there. I think it's a very rewarding position to be working in, whether it's in a clinical setting, or a school setting or a hospital setting, because I think I leave every day feeling productive in some way.
Mm.
I don't know that my accountant can say that.
So, my next question, you say that you feel productive each day. How do you balance? You said you've got, these really long days, particularly right now. How do you strike that work-life balance?
That's a great question, because self-care is really important. And I think that would have been my second thing about empathy. What are you looking for? Is being able to have self-care and take care of yourself. And I think there are ways to set very specific boundaries. I do believe very strongly in the mind-body connection, and so physical exercise and having an outlet. I walk every morning. Didn't this morning because it was raining, but I walk every morning that I can. Sometimes in the evening, I do the same thing as well. I set very specific boundaries, for my cell phone. My cell phone is the emergency contact for my clients. I never answer the cell phone when somebody calls. If it's important enough, they will leave a voicemail, and that
Mhm.
allows me the opportunity to kind of assess where things are. Clients do text me that have a specific need to do that, but I make it a point not to text back immediately unless it's an emergency, and then I'll call them. When I'm at home and I get an emergency call, I never take emergency call in my house. Sounds kind of funny, but I will walk outside of the house. I will be either on the front porch or out in the garage or out in the driveway. I will not take a client call in the house. I don't take a call in my car if somebody's in my car with me. So those boundaries I have to set. I have to recognize those.
Mhm.
I also have to make sure that I get counseling for myself. I have my own counselor that if I have had a particularly tough situation at a court case last week that didn't go well, I had to sit down with my counselor and process that. Unfortunately, one of the things that happens sometimes is things don't always work out wonderfully. And so if I've had a tragic situation with a client, I make sure that I see my counselor to process that situation to take care of myself. And so I have to practice what I preach.
Yeah, no, I think that that is wonderful. And so, in terms of self-care for students, so you mentioned things like exercise and setting boundaries. In their world where they are constantly bombarded with social media, what is your advice to teens or even adults for?
Even adults. You're right. You're right. Yeah, you got to shut it off. You got to put it up. I think this has been an incredibly mind-blowing year and a half here. 2 years ago, if I did a presentation with, Robin Hood Pediatrics or another pediatrician, we would have said, based on the American Psychological Association, the American Medical Association, anybody under the age of 16, we don't recommend any more than 3 hours of screen time. Well, we threw that out the window these last couple of years.
Yeah.
And so, it's a matter of we are all surviving because of the screen time that we have. That's how we're being educated. That's how we're working. That's how we're visiting people and socializing. And so I think we've got to take care of ourselves in other ways. And I can't stress enough, the people that I see that are having the most difficulty are people that are not getting regular exercise on a daily basis, even if it's just walking 30 minutes or riding an exercise bike or, walking the dog. Is people that are not paying attention to the boundaries. I don't recommend anybody do their homework in their bedroom. Your bedroom is for sleep.
Hmm.
It's for winding down. It's for spending alone time. It's not for doing schoolwork. And yet that's difficult if there's no other room in the house that you can do it in.
Right.
So I realize that there are some boundaries that you can't draw. But I think the people that are having the most difficulty are not getting physical exercise. They're not shutting off their electronics, all their electronics, putting their phone up. They're not, spending time talking with people real time, even if it's a mom or a dad or a brother or a sister. And
Hmm.
so I think the balance is what's got thrown way off for us in the last year and a half.
So, how do you envision this transition for us in terms of mental health, of getting back to, eventually maybe the masks come off and the social distancing goes away and we're all back in person? What do you imagine that might do?
Yeah, I think it's going to be an interesting evolution. I think in some respects, we will be masking in certain places from now on. I think we'll be masking on airlines from now on. I think we'll be masking in indoor crowded events like concerts and things from now on. I think COVID is not going away; it's just going to be managed, and I think that we're going to have to be ever aware of that. But I think we're seeing, we've learned that people can indeed work from home. And so I think there will be more careers where people can work from home.
Hmm.
I think we are seeing that we can educate via virtual education. And I think that's going to open up some possibilities. And good example is if I am a freshman at UNC Chapel Hill and I want to take a freshman biology class and they've limited to 200 people and I can't get in, that they may possibly open that up to more people virtually because they can't take biology 102 until they've had 101. And so
Hmm.
I think it's going to give us a little more flexibility. So I think we're learning some things that we can do that we really hadn't explored because we weren't forced to. but I think we're also going to realize that we've got to figure out how to sit in a room with somebody, personally, one-on-one. And I think that we'll probably have to practice that.
Mm-hmm. Yes, and you've got a question in the
Yes,
chat.
I saw that it went off.
So you don't.
That's a good question about whether it's going to be a seasonal event or whether it's going to be more regular. One of the things that I read in the news today was that we don't expect, to reach herd immunity in the United States of America. We haven't, convinced enough people to become vaccinated that COVID is here to stay, and we may see it in milder cases. I think what's very telling is that seasonally, the flu this year has been down 89% by the last statistics that I saw. And so the fact that we've been isolated and masking and being more aware of cleanliness has cut down on the flu. So I think that there will be some masking that's associated with seasonal events like flu season, and COVID season doesn't have a season, but I think that will be part of that. I think it's really more in the larger groups of people that will make a difference, and I think that's where we have to make an adjustment in our own head about this is the new normal for us, that this is how I stay healthy, is to be able to mask in large groups of people that may not believe the same thing I believe about vaccinations.
Mm-hmm.
So it's a tough situation.
Yeah, definitely. And I was listening to a podcast today that I've created some questions for the students, and it was talking about the different cultural reactions to masking and COVID. And oh, you've got another question coming in.
Yeah, this is from Torrin again. What do you think about a nationwide mandate on vaccinations? That's a very political question. Would I want to mandate that? Yes, but I also believe in vaccinations, and I've been vaccinated with everything I can be vaccinated with. Is it something that I think that I hate that it has to be political too, Tor? I really do. And I think that's what, unfortunately, COVID was made political. I think that's kind of where we're at with that, is that, it became a very political hot spot for lots of people, and I think continues to be, instead of it being a health issue.
Mm-hmm. And that ties in with my next question about sort of sociocultural, that kind of perspective, and then the differences we see, in different cultures that are more about the collective versus the individual. And how much do you see culture or society playing a role in mental health issues?
Oh, it's a big thing, and I think that we try with educational, continuing education, to look at cultural issues, and I think the cultural issues go beyond just culture itself. It even goes to issues of sexuality and issues of understanding that, and I think then you enter into religious issues. So it's a very scattered web of possibilities with that, and that goes back to something I said before about being beyond my scope of being beyond my scope of professionalism. That if I am in a cultural setting that I may not really understand what's going on with this based on the culture, do I make a referral to someone who is more culturally connected to that individual? I think I would love to see a wider range of cultural counselors in Winston-Salem. We tend to not be very widely balanced culturally, and I think we need a lot more of that.
And then Torin put another in the chat to build upon my question. How do you think morality plays a role?
And Torin, are you asking about how does morality play a role in the previous questions, or can you complete that a little bit more so I make sure I answer your question?
And Torin, you can unmute your mic if you'd prefer.
Yeah, that'd be fine.
Oh, I was gonna ask. Well, again, good afternoon. I was gonna ask, how does morality play in more so Miss Michelle's recent question?
With mental health, is that what you mean?
Yes. Hold on, my dad's calling.
Morality and mental health. And I think that's a there's got to be morality on the part of the counselor. You know, we have a massive ethical standards guidelines for the American Counseling Association, American Psychological Association, that speaks very specifically to lots of ethical guidelines, which unfortunately shouldn't have to be there because they should be moral decisions, but they are there because in any profession you have to make sure you outline all the possibilities. And I think so morality plays a big role in being able to do the job you're doing. But I think it's rather than morality, it's really more about ethical ethical practice, I guess is the best way to say that.
Yeah, and we've talked a lot about the ethical guidelines surrounding research.
Oh, yeah, that's where it started. The ethics started there.
And my next question is for students who feel like a career in counseling is for them, what could they be doing now in terms of volunteer opportunities or shadowing or interviewing?
Yeah, and that's a tough question because I think you can't shadow me because of HIPAA, rules and being able to remain anonymous. You really can't shadow other people for the same reason. But I think any time that you can volunteer in a setting that allows you to see a different side of life than you're used to, if you volunteer for City Lights Ministry, where they run the bed program and that they build and provide beds and new mattresses for children that don't even have a bed, that gives you a little different perspective about growing up in Forsyth County. If you volunteer for Food Bank of Northwest North Carolina, and you begin to look at statistics and see what it serves, and that Forsyth County is basically one of the highest levels of hunger in North Carolina, and we live right here in Forsyth County, it gives you a different perspective. So I think any volunteer activities like that is important. I think certainly the more that you pay attention to what you can do in a school setting, is there a peer counseling group in your school setting? Is there a gay straight alliance that you were part of in your school setting? Are there other things like care club, cancer club, etc.? So I think that's something that you can see a lot of where you're going to be able to look down the road and get at least a glimpse of it. Got another question here is, when you have clients who are struggling with their identity, their biggest difficulty is their parents not being accepting and very conservative, do you counsel the client's parents as well? Yes, and that's a tough question because I meet lots of young people that are struggling either with identity issues or gender dysphoria, or even just sexual questions about themselves. And there are a lot of parents that aren't willing to look at that. I do struggle in the state of North Carolina at age 16, you can seek counseling on your own, even without your parents' consent. And so sometimes I have had clients that will work with me and their parents are not involved because they don't want them to be. I have to be very careful with that because I can't make recommendations about certain things, but so it's a fine line, but I'd rather than be talking to someone. There are lots of great agencies in Winston-Salem, Forsyth County that I refer people. North Star LGBTQ Center down on Broad Street has lots of great referral information sources for parents that are struggling with trying to understand that. PFLAG in Forsyth County is one of the stronger PFLAG groups in North Carolina. And so I try to get parents to be involved if they can or will. Sometimes I run up against some parents that are unwilling to budge. And at that point, the best I can do in a therapeutic setting is to be supportive of the individual that I'm working with and continue to help them find ways to express themselves that doesn't get their parents to threaten them with something else. It's interesting that there are some parents that still think that I can get my child counseling to make them not be homosexual or not be transgender, and you can't do that. That's illegal. That has been that way for a couple of years, but a lot of parents are not aware of that. So it's a fine line of balancing the parents with supporting the young person that I'm dealing with.
Yeah, so kind of thinking again back to, oh, we got another thing in the chat.
Yeah, Torrin said, how often I've seen the reverse situation where, Torrin, can you be a little more specific?
Oh, no, no problem. I meant I was gonna elaborate. I just didn't want to type it all out. What I also mean is I definitely see, sadly, I see a lot of cases like you're talking about where the parents are trying to diagnose the children and use therapy as a way to bend them to their shape and their mold. But I've also
Okay.
seen, for them to be like you said, for them not to be homosexual or transgender. But I've also seen the reverse issue, and I was curious how much you've seen in a clinical sense, where parents try and overcorrect, where they'll try to be so progressive in their mindset that they'll try and force homosexuality or the transgender mindset on their children when their child hasn't voiced that themselves. So not necessarily that their child doesn't express that, but the child hasn't voiced it. They aren't at the age where they can, clearly voice themselves, and the parents overcorrect.
I think that would be a rare scenario. I have not really had something that specific. I
Mm,
have had parents that are more than willing to be, really open to their
of
kids
course.
if they feel like there's something going on, but the kid's not ready to talk about it yet. So,
Mhm.
that would be a rare situation. I usually will have, more of the young person themselves are a lot more versed in their own research and understanding of what's going on than the parents have been.
That makes sense.
So you talked a little bit about misconceptions, and one of those misconceptions about, the legality of trying to counsel someone out of sexual preference. What are some other misconceptions that you kind of run into if you're sitting on a plane and somebody says, "Hey, what do you do?" and you tell them what you do, about the field of therapy and psychology?
Well, and I think a lot of people think I have a great job. You sit around and talk to people all day long. That's all you do. Yeah, it's true. But there's a lot of stuff that I'm doing with that, and there's a lot of direction that goes into that. But I think there are some people, I have some parents, mostly fathers, maybe, that come in and say, I don't believe in this psychobabble. I think my kid just to needs to pull himself up by his own bootstraps. Just get up out of bed and get busy. And I think, the misconception is it's not that easy sometimes. I think that the addictions are another piece. People have a hard time understanding that addictions are really physiological by the time somebody is fully addicted in either in substance abuse. And we know that genetics play a big role in that, as well as the practice and the opportunity. So I think there's some misconception about, you just need to stop drinking, or you just need to stop doing drugs, or just, stop, smoking weed. And I think the misconceptions are this, because it's easy for me, it should be easy for you to do that.
Mm-hmm.
As opposed to, sometimes there are people that are struggling mightily with trying to just find some balance in their life. And I think not being understood is difficult for them.
Sure. And when you're talking, this kind of plays into that empathy piece that you were referring as a really critical soft skill for this job. So when you're interviewing someone to join your practice, what kinds of questions do you ask, or what are you looking for to get an idea if they have that empathy or not?
Well, and I'm very cautious. My business partner and I have been in practice together since 1985. And we've known each other that long, and have been through multiple career and personal crises, and so that's a gimme. The young woman that I have in my practice now that sees more females, adolescent females, than I do, I actually did her supervision. So I was able to see her in action for a couple of years and know how she worked and actually do the supervision piece for her. So I knew what she could do. And that was another young woman that I did a couple of years ago, the same thing. I did her supervision. So I just don't, I don't advertise if I have an open office, and I don't try to find somebody to fill it. I'd rather pay extra money for an empty office than having somebody here that I don't think is going to do a good job. So I have to see them in action myself.
Sure, that makes sense. And as you were going through your training, either through Wake Forest or when you were working at East Forsyth, did you have a mentor?
Yeah, I have a mentor who is still my friend. She's 80 years of age. She's still a friend of mine and still a mentor. And so yes, it's been let's see, she's been my mentor and friend longer than I've been married. So that's a good thing.
Wow, that's amazing. So
Yeah.
as students are, getting into their career choice, how would do you have any advice about type of mentor they should seek out or how to build that relationship or the importance of having a mentor even?
I think what will, almost always the mentor will find you rather than you finding them. I think it will be, a professor that you have that wows you with something that he or she says, or it'll be a person that you've worked with in an internship that will become a mentor. So I think, the best you can do is to learn, involve yourself in as many opportunities if you're in a college or a graduate school program, so that you're exposed to lots of different people doing different things. And I think you'll find your mentor that way, or they will find you.
Mm-hmm. That makes sense. And anything else that you would have as pieces of advice or encouragement when it comes to students who want to seek this field?
I think I call this the job that keeps on giving. I keep learning and experiencing more every day. The more I learn, the more I realize I don't know. I have to get 50 continuing education credits every 2 years to maintain my license. I see 35 young people a week, and I see them different about every other week. So I'm seeing 70 to 80 clients a month. I work 50 hours a week minimum. So you have to be willing to say, this is a big part of my life. It can't be all of your life. I would hope I would say to my own children, I don't think I have not been involved in your life because I've been doing this, but I think it's a big piece that you got to realize this is more than a job. I think, I have been invited to weddings, which I've had to turn down because ethically you're not supposed to do that. I have unfortunately been a pallbearer at funerals for clients that didn't make it, and that's difficult. So I think you've got to be able to look at both ends of the spectrum, are a big part of this counseling profession. You've got to be willing to kind of live it and breathe it and be a part in it, and know you're going to celebrate when somebody succeeds and know that you're going to cry when somebody doesn't.
That makes sense. It's a calling for sure.
It is a calling.
And I just wanted to leave a little bit of time for any other questions the students might have.
Okay.
So feel free to unmute your mic or type it in the chat.
One question I have. So
Yes,
I
sir.
find myself talking through a lot of my friends, and I find myself functioning as an informal counsel, more so because I tend to be very empathetic with my friends, just kind of listening, because a lot of times they don't have a lot of people to talk to. And one of the things I end up talking about a lot is anxiety and how to cope. Actually, right before this call, I spoke with one of my friends, and she's talking about the two schools of thought when it comes to anxiety. And I just wanted to hear your stance on anxiety, how you like to think about it. What are your thoughts?
Anxiety is real. It's more than just stress. It's very physical. you kind of have levels, the anxiety that, that all of us feel when we're a little nervous about a test, or a little nervous about, a date, or a little nervous about, going to do a new job or a new school. And then I think you've got a generalized anxiety disorder where I just kind of feel a little nervous all the time. And then you've got breakthrough panic, where sometimes I just lose it. And then you've got panic disorder. And so I think there's several levels with that. I think there are times when an anxiety disorder and the experience that you have is great enough that you just have to have some kind of medical intervention with medication in order to calm the physiological down enough that you can make some changes with the emotional and the cognitive. I think there's a lot to be said about being able to work through the anxiety and be able to feel it. There's exposure to the anxious moments, or the things that make you anxious, and how do you learn the breathing and the relaxation techniques and the emotional calming in order to get through that anxious moment. So I do believe that there are times when when that's very helpful to do. But I also realize that with anxiety comes the depression that goes along with that. And the more anxious I get, then at times my brain says time out, and there's some depression. The more depression I get, the more anxious I get. And so we have to break that cycle in order to be able to move forward with that.
I know something my friend that I'm talking about that she mentioned, she talking about how you can beat this type of mentality where it's like an attainable goal could be detrimental, just because if you're not necessarily beating it or getting a hold of it like you're expecting to, it can kind of bring you down. And then I said, well, maybe instead of that, because I'd sent her a TikTok that had primed this whole conversation. Instead of saying it that way, I said maybe you can grow to manage this with greater success. You can grow to manage your anxiety with greater success. I'm just trying to be more empathetic but realistic with it. Now, I guess my next question on that would be, where do you think that you can have? Well, that kind of answers itself. What kind of genetic what kind of genetic disposition are there that would lead you to be more susceptible for generalized anxiety or panic disorder?
I think that we could spend an entire day talking about genetics and mental health disorders. I think that, and my favorite, phrase that I use a lot of times with anxiety is, just when I figured out all of life's answers, they changed all the questions. And so I think that anxiety is an ongoing kind of thing that, I figured out my anxiety about being 18 a long time ago, but then the questions changed, and I had to figure out the anxiety about being a parent. Then I got to figure out the anxiety about being old, and at some point I'll have the anxiety about dying, so I think it's a matter of recognizing that, that there's, some of us genetically are just a little bit, well, I think my daughter would say hard-headed. We're a little more hard-headed than others, and we just don't all, give in to the anxiety that we have. And there are other people that are just so open, and they're empaths, and so they feel things so deeply that it's a very strong, powerful emotion. And so I think there's a lot of complicating factors. And I think the two things that I would point out most, that genetics are genetics. You either got it or you don't. The issue is, what are you going to do now, in this moment, in the present, to be able to manage that?
We could also go into the nature versus nurture debate with how do you think their parenting styles and everything.
Oh yeah.
Yeah, but that again, that.
Well, Miss Michelle knows we always blame the mom, right?
That's true. I tell my boys that.
The mom gets blamed in success or in failure. So, Miss Michelle,
Right.
you got all
That's right.
all the risks. You either get all the rewards or all the.
That's correct.
I mean, it's up in the air. Uh-oh.
And my daughter
Uh-oh.
blames me. You see that? Thanks, Ava. I blame the dad.
That's awesome. Any other questions? I know there's a lot that we've discussed, and so there's a lot to think about, and and sort of let that percolate. But
Well, and Ms. Michelle, if you would, I don't mind if you share my email address with your students, that if they have
okay,
a follow-up question, that they can just identify themselves and, and here's a question, or, what programs would you suggest looking at? I'll be glad to respond to those people individually as well.
wonderful. Thank you so much. I so appreciate you taking the time. I know that you're very busy, and we appreciate you sharing your expertise and your experience and answering all of our questions. It's been a pleasure.
Glad to be here. Thank you for the opportunity.
Yes, and you got a thank you from your daughter too.
You're welcome, Ava.
All right. Well, thanks again, and I hope that you enjoy your walk. I think you might get one in with the
might get
rain.
one in. That's right.
Yeah.
Thank you, Bree. Bye-bye.
Thanks.
Thank
Take
you.
care.
Have a good one.
All right. Good night.
Good night.